The moment I wake up, before I put on my makeup, I say a little. Yes, Nikki Thomas in the afternoon, live on the radio, live on the internet this evening. And as you can see, we have another special occasion, another informative occasion for you today. I hope you're having a wonderful, what's today? Thursday. KBLX Nation, I have a super special guest today, and we have the information that you need in your life right now. Darnaro Evans, as usual, is first in the room. Hey now, Darnaro. How you doing today, my honey bun? Darnaro is a winner, baby. $1,000 holler with the dream team. We just had another winner this morning, Darnaro. So, you held your title for a little while. But, we're making winners all over the place with the $1,000 holler. Dream team in the morning. Amira, did you hear your shout out this morning? Not this morning, but this afternoon. I gave you a shout out on the radio, Amira. And Alicia Paul is here as well. All right. So Nikki Thomas in the building. And my next guest needs no introduction. I've always wanted to say that. I've been like 30 years in radio, and I don't think I've ever said that. But it's absolutely true today. Hi, Nora. I see you, honey bun. My next guest needs no introduction, but I'm going to reintroduce him anyway, because if you really KBLX fam and KBLX OG, you already know the voice, and you already know that the work that he is doing in the community. Keisha Ford is here. Kelly Gregory is here. Juanita is in the building. Happy Thursday to you, my honey bun. Everybody share this video. Share the video right now, because I know somebody on your friends list needs it. Checking in from Monroe, Louisiana. I see you, Chuck Hunt, and Terry Ricks is here as well. Much love to you, Amira. All right. So we are in the midst of a pandemic impacting our lives, our mental health, our physical health, our jobs, and in some cases, loss of health insurance. Over the next 2 weeks, we're going to be focusing on these topics with lifelong medical care. This evening, we have the one and only Dr. Michael Lenoir. He is the chairman of the African American Wellness Program our project, rather, and you have heard his voice on KBLX for about 20 years now. So he's family. Please welcome Dr. Mike Lenoir. How are you this evening, sir?
Thank you. Fine. And you?
I'm doing great. I have been looking forward to this. And we are so glad that, we have folks in the community like LifeLong Medical Care that will address the questions that are already in our minds. Because, we've had so many changes in this past year. It's hard to keep up with the latest information. And, the other thing is trust, the trust factor. We want to be able to trust what's happening. So, Dr. Lenoir works with LifeLong Medical Care, renowned allergist in the Bay Area. So this is exactly the person that we want to hear from tonight. So he's going to talk to us about the importance of understanding the benefits of taking the vaccine. Because let me just tell you, on a personal tip, question mark. Question mark for a lot of us. So Dr. Lenoir, thank you so much for joining us this evening. Tell us about your work with LifeLong Medical Care before we get into some key facts about the COVID-19 vaccine for our community.
Well, for a number of years, I've practiced kind of independently, both consulting allergy, pediatrics, and I was looking for a place to land my practice with a group that shared my values. For 45 years, LifeLong has been in the business of caring for people who other people would otherwise not care for. And they have an open policy, a lot of good information to people, not just taking care of them physically, but taking care of them from an informational point of view. And I thought that when I looked around, this was the perfect place for me to land. They've allowed me to do both my specialty and to do pediatrics. And for me, they even named a clinic after me. Maybe the only lasting legacy that I have around that I can talk about. And so consequently, my relationship with LifeLong, my respect for them as a program is just outstanding. They're just it was the perfect fit for me. And I think that I've been very satisfied with the ability to work with them, their educational programs, their administrative process, and the patients that we're able to serve.
This is amazing. Amazing. All right. So the topic of the hour, and a lot of folks are saying the same thing in the comments here, Dr. Lenoir. Juanita Adams said, yep, that's me. Question mark, question mark, question mark, question mark. Lydia says the same thing. Question mark. Right. So tell us why we should take the COVID-19 vaccine. Because again, everything happened really fast. All of a sudden it was like, bam, here's a vaccine. Give us, the reasons, the benefits, and some reassurance maybe.
Well, let's look at some of the misconceptions about the vaccine. COVID is a virus that's been around for a very long time. COVID viruses, they differ a little bit in terms of how they are structured. For instance, if you look at trees, for instance, you can take like pine trees. They have the same trunk. They differ in the branches. And that's the way the COVID virus is. It's a different branch of the same tree. People looking at these viruses for many, many years, doing research on the viruses, looking at vaccines against the COVID viruses. And so that to make a vaccine against a virus which differs very little from the main trunk of the tree was not that difficult. In addition, now you can look at the genome of a virus. I mean, you can take it and tear it apart, look at its genes and see where it's attaching to your cells. And so consequently, with the new technology, plus the fact this is not a new virus, allowed people to make a vaccine much more quickly than you would expect for other vaccines.
Right. Okay. So I love the way you explain that, the tree, the branches. So this is why we say it's a coronavirus, but COVID-19 is the specific.
Is a specific one of the coronaviruses. They've been working with these coronaviruses for years and years, looking at vaccines, looking at ways to deal with other coronaviruses like the SARS virus and others, so that to make a vaccine against a virus which differs very little from the things they've been working on allowed them to get to the market with this vaccine much more quickly.
Okay. All right. I like that. Okay. So what about those of us who do not trust the medical establishment? There's been, when I say question mark, there's been lots of question marks in the medical establishment. I'm not even sure how to ask the question is, how can we trust? Tell us something that would make us trust a little bit more.
Well, I think that African Americans should have a healthy paranoia about anything to do with vaccine.
Yeah.
For 400 years, we've not been well taken care of. We've been experimented on in the most egregious ways. And so having a healthy paranoia is really what I think is an appropriate position to be in. But here's the difference. We've been able to take an attitude toward vaccines that's pretty casual for most of our lifetime. You can say, I don't want the measles vaccine. I don't want the mumps vaccine. I don't want any of these vaccines. And you'll be able to get away with that because everybody else was vaccinated. And so you went somewhere and you were probably the only one not vaccinated. And so consequently, your chances of getting these diseases was much different. This is a whole different thing here. I mean, if you get this virus, no matter when you get it, then you're going to have the same risk factors that people have right now who are in that 499,000 group of people. And I'm not trying to scare people because I think as a doctor, I have to respect people who make a decision not to get a vaccine as much as I respect people who make the decision to get one. But here's what's going to happen. You will not be able to live your life ever normally if you don't get a vaccine. Because if you go, say, to church with a lot of people, or football game, a jazz concert, you go to the Stone Soul picnic,
right?
There are a lot of people there vaccinated, so your chances of getting the coronavirus are reduced. There's going to be somebody right there near you who didn't get the vaccine, who may be carrying it, or somebody who's been vaccinated who might be carrying it. And once you get it, your chances, your morbidity, that means how sick you get, and your mortality, that means if you die or not, is exactly the same as it is right now. Now, when we talk about the morbidity, what I'm seeing from other people and what I'm hearing from across the country is once you get a coronavirus infection, even though you don't have to go to the doctor and you're not that sick, something's wrong with you for a long time after that. And so consequently, we've been able to get away with not getting the measles and the mumps and the rubella back because everybody's vaccinated. But nobody's vaccinated for this right now, less than 4% of the country. And so you have to be prepared, and you are certainly entitled to make a good judgment about that. But you have to be prepared to live your life with that virus over your shoulder for the rest of your life. The other part of that is all these variants they talk about so casually. We're going to hit one variant that's going to be really lethal, but we know they're more infectious. We also know that if you get the vaccine, you're less likely to pick up one of these variants, and you're less likely to suffer from it. So I think we've been able to say, okay, I ain't getting no vaccines. I'm not getting no vaccines because everybody else around you has been vaccinated. But once you start talking about coronavirus, nobody around you is vaccinated. If you're unvaccinated this year, next year, whenever you're unvaccinated, you'll be at much greater risk to catch the virus.
Okay, so I don't think anybody has ever said that, or, maybe I wasn't listening to the right things. The reminder that we are going to hit other variants of this is just the tip of the iceberg, is an excellent point, because we're seeing and hearing about the variants. So you think things get a whole lot worse, right?
People don't understand what variants are. What variants are, when the coronavirus infects you, gets into your cell, in the center of your cell, and starts making its own virus, takes over your ability to make what that cell is supposed to make, and starts making its own virus. It started making it so fast that it makes mistakes in the genetic code. It so happens that some of those mistakes make it more lethal, make it more aggressive, make it more difficult for people and vaccines to handle. And as we go further and further and further along, you're going to get one of those mistakes that's going to say, hey, I don't care about this vaccine. And you may have made that vaccine, but I got something in my DNA that's going to protect you against, that's going to get against that vaccine, and it's going to take over the whole process. Now, what we see is that the current vaccines are able to handle the coronavirus, but they don't completely handle it as well as they handle the regular coronavirus. And it does seem that if you're vaccinated, even if you get one of these variants, you're less likely to be sick and you're less likely to die.
Okay. And so the thing is, you're a doctor, you're out in the community, you're already seeing what's happening, you're seeing the effects. Tell us a little bit about what COVID is doing to our communities, because the only power we have, or the information that we have, is like what we see, what we hear, what we see on the news. And sometimes it seems like it's, very packaged, or we're seeing the same things and the same stories over and over again. Can you tell us what it looks like to you on the ground and what the numbers are looking like in our communities?
Well, we're probably less than 4% of the vaccinations. We're twice as likely to die from the virus. I think the problem is that if you look around in the community, you're going to find that we, as African Americans, were always considered more at risk. Now, I remember seeing CNN, all these places, wondering why African Americans were so much greater risk than other people.
Right.
As a Black doctor, I wasn't surprised. I knew that when America sneezes, African Americans get pneumonia. And we do that. So there's several reasons. One is that we're the early bus responders. We don't get picked up on nightly news and all that. We get the nurses and the doctors, and they're to be respected. But we're the ones that drove the buses and worked in the nursing homes and worked in the grocery stores. We were sitting there doing all of this without recognizing there was a virus about to take over us. The second thing is, if you look, for years and years, we as Black doctors have been screaming about this country allowing Black people to be sicker from the cradle to the grave from every chronic disease. So if you have a chronic disease and you're exposed to the virus, then you're going to get sicker. And that's what they call health equity. And I'm sure you probably know the statistic that the life expectancy for a Black man living in the East Oakland Hills, as opposed to near the airport, is 7 years. And it's 7 years because we in this country have allowed Black people to be sicker with chronic diseases for as long as I can remember. And so consequently, A, when you're exposed to a virus you don't know is out there, the early bus first responders, like Jesse Jackson used to talk about, and B, when you're sicker to begin with, And then you throw in all the other social determinants for housing, lack of access, the way we're treated differently. Wouldn't you, Nikki Thomas, hate to be in an emergency room where the doctor that was not like you was making decisions about who got that ventilator?
Well,
Well, I mean, we have to talk about unconscious bias in decision making about who gets what and when. And so, consequently, you throw in those three factors. First, that one of the factors is that we were the early bus responders, didn't know the virus was out there. Secondly, sicker to begin with. And third, once we get into the system, we really don't know how the decisions are going to be made in terms of who gets this and who gets that, and who's going to be able to walk out of there in one piece.
so Renee has a question here. What are the contributing factors that make it more lethal for some than others? That's always been the big question. I've heard different things. What can you tell us about that?
Well, the immune system is very complex.
Mm-hmm.
Thinking about the immune system is just one punch at something that invades you. But there are a lot of different pieces to the immune system. Some people have more of this and more of that. And whatever your immune system is composed of determines how well you deal with things that are not you, even strep or flu or whatever. So some people get sicker with the flu than others. And some people have different immune systems that, while they protect you, are going to protect you a little bit more in one area than the other.
Mm-hmm.
So that's one thing. The second thing is the volume of the virus that you get when you are exposed. So consequently, if you're at a big party and you're around a lot of people, the volume of the virus that gets in your system will also determine. And I think the third thing is that those of you who are not wearing masks, who are not social distancing, not washing your hands, you're much more likely to get a larger volume of the virus. But these new variants, it's like a magnet. I got these little magnets that hold my shirts together and look like they're alive because they slam together. But
Mm-hmm.
if these new variants slam much harder into your cells than the old variants, and I
Wow.
think it has a lot to do with it as well.
Wow. You're giving us information that I have not heard in other places, Dr. Lenoir. If you're just joining us, Lifelong Medical Care, we're doing some FAQs about the COVID-19 vaccine with Dr. Michael Lenoir, and he is giving us the information that we need. Okay, so what about the side effects of the vaccine? I know a few people that have gotten, either their first dose or they've gotten both of them. Is there anything that we should expect when we get ours?
Well, I've heard that people get, soreness at the site. Some people get chills, and fever. And I think being tired is probably the number one side effect. I've had both my vaccines. I tried to get three,
Mhm.
but I got both of them, and I didn't have any major problem with them. I got a little bit tired with the second vaccine, but had no problems with the first. And being tired, it was only for 24 hours. The rest of the time, I've had no problems. But some people do get chills and fever, but it usually lasts for less than a day. And I don't know anybody who's had any permanent long-term effects from the vaccine.
Mm-hmm. Okay, that's good news. So, what is Lifelong doing now about the vaccine?
Well, LifeLong, has a system that if you're eligible for the vaccine, they'll make sure that you get an opportunity to get that. And more importantly about LifeLong, and the thing that I've always loved about being part of that, is that they're providing information to all the communities. They're
Mm-hmm.
certainly talking to the African American community and to the communities most at risk, the Latino communities, where absolutely I've seen some numbers like in some parts of California, they're 50% of the deaths and less than 8% of those people being vaccinated. But LifeLong's been out in the community talking about the importance of social distancing, wearing a mask, and washing your hands. That's from the very beginning. They're talking about the value of the vaccine. They're showing that here's what intrigues me about this vaccine is that we set up special areas in the African American community. Finally, even though we were most at risk, I thought they'd come out the blocks with programs for African Americans. But George Floyd, made a lot of people guilty. But I bet if you walked into a large community that was not black and mentioned the name George Floyd right now, they wouldn't know who he was. So we're hot for a minute. But while we were not hot, when we set up these things in our community, people come from other communities. They come from San Ramon and San Rafael and Danville to get a shot. And so if they're coming to get that shot from all these different places, when I see people come to get something they think is pretty good, I at least evaluate it. And so consequently, lifelong, if you're in a lifelong plan and you're eligible, they're going to try and get in touch with you. And they'll give you an opportunity for testing, and they're certainly going to give you an opportunity to get injections.
Mm-hmm. Wowzer. So Tashaya has a question. What happens? Let me get the question on the screen here. What happens if you don't get the second dose? Do you have to start over again?
Shea, I'm an immunologist. I mean, that's been my training, was in immunology. And I believe once you get one dose of that vaccine, you have a much longer lifespan for protection than people say. I have heard that one dose of the vaccine may help you for maybe as long as a year or more. You don't have to start over. Your immune system remembers. One of the things I love about being an immunologist is the immune system, because the immune system can remember what you didn't like 20 years later.
Wow.
So let me give you an example. If you're allergic to peanut, and we should talk a bit about the allergies to the vaccine. If you're allergic to peanut, and you don't eat a peanut for 20 years, and you come back and eat a peanut, that immune system said, here's a peanut, and I'm going after it. So I believe that if you get the first vaccine, I think anytime you get the booster vaccine, you still will be better protected.
Okay. So yeah, we have a few questions here. Renee says, can you get it twice? Can we get COVID twice?
We really don't know. I
Mm.
mean, I think there have been reports of people getting it more than one time in parts of Europe. But I think that with proper vaccination, here's what I believe. I believe that you're going to have to get more than one vaccination in life. You may have to get a vaccine every year or 2 years. That's what happened. I had a patient of mine come in today who needed a second meningitis vaccine. And she wanted to know why. She wanted to know why, because when you get a vaccine, your antibodies go up, but gradually they start to go down. And as they get to a certain point, then they're not protective anymore, and you need another boost of your immune system. So you probably can get, and with these variants, I'm telling you, there's going to be a variant out there. I don't know what the name is going to be. And I think they're naming after birds right now, but I don't know what. It's probably going to be like the blackbird or something like that. And if you aren't protected, then you probably, even if you are protected, you may be at risk for one of these variants.
So this is a whole lot of reassurance here. So you're on the ground, you're in the community, you're saying you're out every day amongst the folks, and that you've received the vaccine. And so for us, if you say, hey, I trust it, that means that we can trust a little bit more.
Well, I think that if you ask people about me for the years, I've been on KBLX and CBS and Pacific and all these radio stations, what people find that I'm very consistent. That's exactly what I think and exactly what I believe. And I love being an African American. I've always loved being Black. And I am definitely not going to go out here to sell a vaccine. I'm just going to give you the truth. And my feeling is that I respect your judgment. And if you decide based upon the information you get, including that I give you not to get a vaccine, I'm going to take care of you. I'm going to respect you.
I love that.
Because you made that decision. But I can tell you right now, this is a very different virus with a lot of lethal potentials. And if you look around at 499 people who died from this vaccine, you will still be at risk if you don't get this vaccine for the rest of your life. When you go to large gatherings, you will still be at risk for getting the vaccine, less if you wear your mask or you social distance. But if you want to go to the jazz concert, one of the things about the Stone Soul Picnic, I've been to thousands.
Right.
Because it takes those acts about 35 or 40 minutes to get back up on the stage. You wander around, talk to people. You're not going to be able to do that safely if you're not vaccinated.
Wow. So there's you know what, you had to throw Stone Soul in there. It's like if you want a normal life.
But I'm saying, see, that's the bottom line. If you can't go to Stone Soul Picnic, what is life worth?
What kind of life are you living?
Right.
What kind of life are you living?
That's what I'm asking.
It was emotional when we had to cancel Stone Soul last year. And I mean, we had to do whole live stream conversations to let folks know, and to let folks get their emotions out because we've been together so long as a family. And Stone Soul is the family reunion.
Yeah, I was looking forward to hearing Frankie Beverly for the 900th time.
Never too much.
Never
Like
too.
Luther said, it's never too much, Frankie Beverly. One more question. Keisha says, which vaccine is better? Is there a difference?
Well, my feeling was I would prefer the Moderna virus vaccine because it requires less nurturing. It doesn't require as much taken care of as the Pfizer vaccine. Pfizer vaccine has to be at minus 90 degrees most of the time. That means the guy that picks it up from the vaccine place, puts it in the trunk, takes it to the place. Everybody has to do their job in order for that vaccine to be properly cared for. And I think most people are trying to do that. I just thought the Moderna vaccine, which is not as privileged, it would allow me to get a vaccine which had been tampered with probably less. And that's why I selected the Moderna vaccine.
Wowzer. Thank you for giving us all these straight answers this evening. Dr. Michael Lenoir, thank you for taking the time to give us the information that we need to make intelligent decisions.
Yeah, well,
So,
I would like to thank LifeLong for giving me the opportunity
mhm.
to speak about this. I think that that shows the kind of commitment that put me in that health plan in the beginning.
So LifeLong, if you want information about, hey, when is it my turn? Go to lifelongmedical.org to continue your own personal research. KBLX family, we already know that you're researching, you're watching the news, you're thinking, you're not just walking blindly into anything. You want some facts and figures, and then you want, someone who has the experience to give you answers just like we received this evening. So reach out to Lifelong Medical Care. They are in our community everywhere. So when you go to the website, it'll give you all the rest of the answers to the
And,
questions that you may need.
yeah, and I would like to say that, Black lives matter, but Black health matters as much.
Yes, it does.
Health is your biggest asset, so protect it.
Yes, it does. Man, I feel better about everything. Dr. Lenoir, thank you for sharing with us. Everybody is loving it. Juanita says, thank you, Dr. Lenoir. Honeybee says, thank you, Dr. Lenoir. Very good information. When I asked you about like which vaccine is better, I was like, you know what I mean? Sometimes you almost expect not to get a straight answer, but it was like, this is the one. This is the one that I prefer. So we can, continue with digging around and saying, hey, Dr. Lenoir said this, let me go check it out. So wonderful, wonderful information here. Thank you for all of your questions and all of your good energy this evening, KBLX Nation. Lifelongmedical.org. Thank you so much, Lifelong Medical Care, for bringing us all together and letting us, kind of sit in some space and see your face, Dr. Lenoir. Lifelongmedical.org, lifelongmedical.org for more information. Thank you so much for your time and for your care, Dr. Lenoir.
Thank you.
And KBLX Nation, Nikki Thomas, FAQs about the COVID-19 vaccine with Lifelong Medical Care and Dr. Lenoir. Y'all have a wonderful evening.